A 2019 document shows that there were an estimated 449 injuries because of roller coaster rides, which translates to nearly 1.3 injuries per 1 million patron rides.
This video is entirely based on medical case reports. But let's begin with something odd and interesting.
According to a scientific study published in the Archives of Sexual Behavior, patrons exiting a roller coaster ride tend to find people from the opposite sex slightly more attractive than people entering a roller coaster ride. Researchers came to this conclusion after showing photographs of people from the opposite sex to participants entering and exiting roller coaster rides.
And now, here's a medical case report. 2 patients with poor vision who were significantly myopic suffered from retinal detachment after their roller coaster ride. So if you are significantly myopic and therefore predisposed to retinal detachment, you should avoid extreme rides.
A simulation-based study reveals that roller coasters may lead to brain displacements and strains comparable to those experienced by mild soccer headers. The study concludes by stating that although roller coaster rides do not present an immediate risk of acute brain injury, the long-term effects, if any, need to be studied further.
Speaking of long-term effects, a bunch of thrill-seeking folks were diagnosed with subdural hematomas, or brain injuries, after enjoying roller coaster rides. But almost all of them experienced pain right after the ride.
The journal Clinical Pediatrics discusses the case of a 13-year-old girl who suffered from stroke after a scary roller coaster ride in the US. CT and MRI scans showed that the ride had seriously impacted her brain. The article titled "Speechless After a Roller Coaster Ride" says that the girl recovered eventually. However, it warns parents about the dangers of scary theme park rides.
A group of researchers recruited 55 healthy adults for a clinical study aimed at determining the effect of roller coaster rides on cardiac health. Nearly 50% of the patients experienced abnormal hearts or arrhythmias up to 5 minutes after the theme park rides. The related article was published in the Journal of the American Medical Association.
And here's a surprise: an adult patient with benign paroxysmal positional vertigo, or BPPV, wrote a letter to the reputed journal Lancet and described how his vertigo got fixed after a roller coaster ride. However, physicians replied, saying that although that may be true, roller coasters could also provoke it.
Finally, a review article published in Annals of Emergency Medicine requests emergency room physicians to include theme park visits in the medical records of patients. It also asks for legislation to regulate the amusement ride industry.
Subscribe to Videonium Sci-Tech for research that matters.